Hello, my
My
name
name is
is
Sabrina Ark, and my colleagues are Flor Dow, Catherine Kyler.
doing
Doing
our
our
assessment
second
on the movie Split.
visit.
So the
The
biographical
medical
data
data
for
for
this
the
patient
patient
is
is he's
initials are KWC. He's 27 years old. He weighs
he was
180 pounds. His height is 5 feet 11 inches.
inches.
His
His
is
he
of Caucasian ethnicity. Patient declined to answer any questions related to religion and surgical history. He speaks English. He's single and he works as a zookeeper. His medical history is dissociative identity disorder, post-traumatic stress disorder, and obsessive compulsive disorder. His main support system is psychiatrist.
Patient's physical health is as follows. The patient's gender expression does not align with his sex assigned at birth. The patient's personality, Patricia, was very task-oriented, appeared feminine, and was modestly dressed. The patient's mood was incongruent with his affect. The patient's appearance was very neat and overdressed, and the patient's manners was very proper and matter of fact. The environment in the video clip looked cold, dark, and organized. The patient's appearance appeared authoritative, instructing the girl as a kidnapped victim in the room to eat. The patient showed signs of marked distress when cutting a sandwich, and it was not precise.
Psychosocial services. He respectfully declined to answer any questions related to religion and education. Before his psychiatric history is dissociative identity disorder, post-traumatic stress disorder, and obsessive compulsive disorder. He does have a family history of OCD. That would be his mother.
Psychosocial assessment continued. The patient's mental status, his appearance was neat. He was overdressed. His gender expression doesn't align with his sex assigned at birth, as evidenced by a patient wearing a dress and a cardigan. He had a buzzed haircut. His skin showed some pallor. His eyes were equal bilaterally. His vision appears adequate enough to avoid obstacles. His ears were equal in size bilaterally with no swelling or thickening. His nose didn't show signs of swelling or redness. He did not let us conduct the assessment for his sinuses or his throat. His mouth, the color was even and pink. His nails were clipped. His mood and affect were incongruent. His behavior was task oriented, and his thought processes were loosely associated. He exhibited tangential thinking and goal directed thinking as well. In regards to orientation, the patient was not oriented to person or situation. We were unable to assess if the patient was oriented to time or date due to patient being non-compliant with this part of the assessment. The patient's insight and judgment was poor, and his interactions that we observed were also poor, as evidenced by his inability to pick up on social cues with the kidnapping victims.
For patient diagnosis, some signs and symptoms that indicate disturbed personal identity were mental illness during childhood. For patient diagnosis, some signs and symptoms that indicate disturbed personal identity were mental illness during childhood, history of mental illness and family, multiple identities, which were 23 personalities, cycling through personalities during an appointment with a psychiatrist, incidents of out of character behavior, memory gaps, emotional and behavioral turmoil. Post trauma syndrome was childhood abuse, inability, and chaos in family, lack of self control, as evidenced by kidnapping girls, her ability and ability to easily pivot and negative thinking, severe anxiety, which are recurring thoughts, about 20 times of the 3 lines they need in a day, repetitive action, fixation on orderliness, um, perfectionism, and control, which are the sandwich was not cut in half perfectly, so he redid the sandwich to get perfect cut. The patient's plan of care, we collaborated with the patient to identify priority problems and goals that we worked on during his treatment. First priority problem is disturbed personality identity. The smart priority problem number 1 is patient will demonstrate safety as evidenced by engaging in no danger to self and others behaviors in the 72-hour period. Goal number 2 for disturbed personality identity is patient will identify 3 healthy, effectively coping skills, strategies to utilize when having DTS and DTO thoughts, urges. Number 2, the priority problem would be post-trauma syndrome. The goal for priority problem number 2 is patient will identify trauma triggers, reminders, and demonstrate the ability to utilize positive coping strategies when triggered. Goal number 2 is patient will demonstrate the ability to regulate his emotions by utilizing relaxation techniques such as deep breathing, positive imagery, PMR, in the moment. For anxiety, patients will develop increased awareness of when feelings of anxiety are emerging and will discuss it with the nurse. Patient will improve to increase understanding of specific issues causing anxiety.
Implementation for priority problem number 1, disturbed personal identity. Goal number 1, patient will demonstrate safety as evidenced by engaging in no danger to self or others' behaviors in a 72-hour period, which was from October 3rd at 4 p.m. to October 6th at 4 p.m. And the interventions for this goal include promoting patient safety by maintaining close supervision at all times, so Q5 minute checks. And the second intervention for the first goal is to utilize therapeutic communication to provide a safe, non-judgmental, and empathetic environment for patient to share DTS, DTO thoughts, urges, instead of acting on them. The third intervention is to assist the patient to identify and recognize stressors that trigger DTS, DTO thoughts and urges. Our second goal for disturbed personal identity was for the patient to identify 3 healthy and effective coping skills or strategies to utilize when having DTS, DTO thoughts and urges by the end of shift on October 6th at 4 p.m. The interventions for our second goal included providing the patient a list of healthy and effective coping skills and strategies to utilize in the moment when having DTS, DTO thoughts and urges. The second intervention was to assist patient to create a crisis safety plan to utilize when experiencing DTS, DTO thoughts and urges. Our third intervention for our second goal was to prompt the patient to verbalize 3 healthy and effective coping skills and strategies he could utilize when having DTS, DTO thoughts and urges.
Implementation for priority problem number 2. Priority problem number 2 is post-trauma syndrome. Goal number 1 is patient will identify trauma triggers, reminders, and demonstrate the ability to utilize positive coping strategies when triggered within 5 days, starting October 3rd at 10 a.m. and October 7th at 10 a.m. Interventions are, number 1 is reassure patient safety if patient is in a panic state by ensuring patient he is in a calm and safe environment. Number 2 is to help patient feel in control, ask about his fears, recognizing what can and can't be changed. Number 3 is provide patient rest periods between discussions to help patient cope with each session. Goal number 2 is patient will demonstrate the ability to regulate his emotions by utilizing relaxation techniques, deep breathing, positive imagery, and progressive muscle relaxation in the moment by October 7th at 10 a.m. The first intervention is to provide patient with positive strategies, healthy ways of coping during a stressful, fearful situation. Number 2 is encourage patient to listen to relaxation music and provide relaxation techniques. Number 3 is to provide patient with information to reassure that those feels of fear after a traumatic event is normal.
For implementation priority problem number 3, severe anxiety. Goal number 1, patient will develop increased awareness of what feelings of anxiety are emerging and will discuss them with the nurse by October 5th, 2022 at 10 o'clock a.m. Interventions for goal number 1 is with the patient's permission, use touch or verbalization to remind the patient they are not alone and encourage them to express needs or concerns. And intervention number 2 for goal number 1 is encourage the patient to use coping mechanisms that have been effective in the past. Intervention number 3, guide the patient to strengthen problem-solving abilities. Goal number 2, for severe anxiety, patient will improve vulnerability to increase understanding of specific issues causing anxiety by October 4th, 2022 at 4 o'clock p.m. Interventions for goal number 2 is educate and encourage the patient to log episodes of anxiety to better understand what causes the events. Intervention number 2, encourage the patient to talk about feelings that may provoke anxiety. Number 3, help the patient become familiarized with the environment.
When reviewing the patient's plan of care, we evaluated the patient's progress towards priority problem number 1, which was disturbed personal identity. And the first goal that we previously mentioned was for the patient to demonstrate 0 DTS DTO behaviors in a 72-hour period. And the interventions that we ended up utilizing to help us meet that goal. The first one was to promote patient safety by maintaining close supervision at all times. So we did 5-minute checks, and we also assisted the patient to identify and recognize stressors that trigger DTS, DTO thoughts and urges. And our patient was able to meet goal number 1. Patient demonstrated safety as evidenced by engaging in 0 DTS, DTO behaviors in a 72-hour period, which was from 10:03 at 4 p.m. to 10:06 at 4 p.m. And for our second goal, the patient was also able to meet this goal by verbalizing 3 healthy and effective coping skills and strategies when he was having DTS, DTO thoughts and urges by the end of shift on 10:06 at 4 p.m. And we were able to help assist the patient to meet this goal by providing him with a list of healthy and effective coping skills and strategies to utilize in the moment. And also we prompted our patient to verbalize 3 healthy and effective coping skills and strategies when he was experiencing those DTS, DTO thoughts and urges.
For evaluation priority problem number 2, the post-trauma syndrome, patient will identify trauma triggers, reminders, and demonstrate the ability to utilize positive coping strategies when triggered within 5 days starting October 3rd at 10 a.m., ending October 7th at 10 a.m. The interventions, number 1 is to reassure patient safety if patient is in a panic state by ensuring patient he is in a calm and safe environment. Number 2, provide patient rest periods between discussions to help patient cope with each session. Evaluation, the patient did meet the goal. Patient was able to identify trauma triggers and was able to demonstrate the utilization of positive coping strategies. Journaling, drawing, listening to music, and exercise 3 times by end shift on October 7th at 10 a.m. Number 2 was patient would demonstrate the ability to regulate his emotions by utilizing relaxation techniques, deep breathing, positive imagery, progressive muscle relaxation in the moment by October 7th at 10 a.m. The intervention, number 1, was to provide patient with positive strategies, healthy ways of coping during a stressful, fearful situation. Encourage patient to listen to relaxation music and provide relaxation techniques. The patient did meet this goal. Patient demonstrated the ability to regulate his emotions by using relaxation techniques, deep breathing, and positive imagery, meditation, and progressive muscle relaxation 3 times by end of shift on October 7th at 10 a.m.
Evaluation for career problem number 3, persevere anxiety. As I mentioned before, its goals of patients will develop increased awareness of when feelings of anxiety are emerging and will discuss them with the nurse by October 5th at 10 o'clock a.m. Interventions that worked with this goal was with the patient's permission or verbalization to remind the patient that they are not alone and encourage them to express needs and concerns. Intervention number 2 was to encourage the patient to use coping mechanisms that have been effective in the past. These goals were met, and the patient did demonstrate an increased awareness of his emotions, as evidenced by turning off the TV, dimming the lights, and calling for the nurse on duty to discuss his feelings of anxiety 3 times by end of the shift on October 5th at 10 o'clock a.m. Goal number 2 was patient would improve vulnerability to increase understanding of specific issues causing anxiety by October 4th at 4 o'clock p.m., with intervention being educate and encourage the patient to log episodes of anxiety to better understand what causes the events. Intervention number 2 was encourage the patient to talk about feelings that may provoke anxiety. This goal was met by a patient demonstrating increased understanding of his anxiety and triggers, as evidenced by verbalizing that he needs to take a time away in a quiet, safe place to gain control of his anxiety when there is overstimulation, such as loud noises, yelling, fighting, etc. on 3 occasions by the end of shift on October 4th at 4 o'clock p.m.
And to conclude treatment for our patient, we will provide some recommendations for discharge. Patient was able to discharge from Fort Rivers Behavioral Health Hospital on October 31st due to successfully meeting his treatment goals. which included engaging in zero DTS DTO behaviors in a 72-hour period as a result of developing an increased awareness of his emotions and demonstrating the ability to utilize his coping skills instead of acting on DTS DTO thoughts and urges. Due to patient paying his bond and successfully completing his court-mandated treatment, he will return home with intensive outpatient services, which include IOP groups and individual therapy 5 times per week, med management and case management, and he will wear an ankle monitor while awaiting his court hearing for his kidnapping charges. And for our very last slide, we have our references.
This concludes our meeting. Thank you much for watching.